Nuamu Laguerre, also known as Dr. Nuamu, known as Dr. Laguerre, known as Ndiva Doc. I am so glad to see you guys here, and I'm honored that you guys came out to share this day with me. This is our 7th annual Paint Party event. Yes, thank you. This is our 7th annual Paint Party fundraiser. The event that I'm doing every year was really started by my younger brother, who I lost last year. He was in his 30s. He was doing the breast cancer awareness event every year. And so I'm doing this. I've always done it with him, but I'm carrying on his legacy in continuing to honor the people that have survived breast cancer, and just keep hope and being in the fight together. So we have a very special event planned today. We have a very lovely speaker as well. I did want to just go through some facts about breast cancer. I know we all hear about it, and some of us have been affected by the disease, losing loved ones or having survivors in our families. But I do want to just talk about some of the statistics, if you don't mind. So unfortunately, the slideshow was not projecting to the monitor, so I'm just going to do it from my computer. Breast cancer is the second most common cancer after skin cancer, but it's also the second leading cause of cancer death after lung cancer. So if we talk about some of the new cases, invasive breast cancer in women is up to 278 million worldwide. There's different type of cancers. Carcinoma in situ is at 54,000 new cases per year. Invasive breast cancer in men is up to 2,700. And the deaths for women, 43,000, while the deaths in men are 530. The 5-year relative survival rate for localized stages is 99%. So localized cancer means that it's on one side of the breast, not both breasts, and not spread all over the body. So we call that localized. So the 5-year survival rate, if it's local, caught early enough, is 99%. The 5-year relative survival rate for all stages combined is 90%. Therefore, early detection is important. So we can do things to treat this disease if caught early. We still treat late cases, but they're more difficult to survive. So there are several types of breast cancer. You'll hear so many different types, but I'm just going to run the list. If you have any questions about any specific one, just let me know. So there's ductal cancer, ductal carcinoma in situ, meaning that it hasn't spread past the epithelial cells, it's still kind of localized. Invasive ductal carcinoma, invasive lobular carcinoma, you'll see them call that ILC, triple negative. There's inflammatory breast cancer, Paget's disease, angiosarcoma, and Floyd's tumor. So risk factors, what makes people at risk to having breast cancer? So both men and women can develop this disease, but being born female is a risk factor. The risk factors increase with age and are most commonly found in women over the age of 55. Breast cancer is higher in women with personal history, either they've had it or a family history of the disease. And 5 to 10% of breast cancers are caused by genetic mutations. I don't know if anyone's heard of BRCA1 and BRCA2. Those are gene mutations that are inherited and are they put you at high risk for breast cancer. Having a first-degree relative with breast cancer increases your risk. So your parents or one of their siblings having the disease puts you at a higher risk. Previous history, like I mentioned, of cancer puts you at higher risk. So some other risk factors, a little bit softer risk factors, are dense breast tissue, using postmenopausal hormone therapy, estrogens, progesterone, certain types of birth control. Also, a known fact that puts you at higher risk is not having any children, not breastfeeding, or having children after the age of 30. These are risk factors for breast cancer. Physical inactivity and drinking alcohol. in large quantities, obviously. So screening and detection. The American Cancer Society recommends the following guidelines for early detection of breast cancer. So they have it all in different lines, but to summarize it, anyone over the age of 40 years of age should be getting breast cancer screening through mammography. Signs and symptoms, the most common physical sign and symptom of breast cancer is obviously having a new lump. Painless usually. Lumps under the armpits are also suspicious. Those are the axillary nodes, your armpit nodes. Other signs are breast pain, heaviness, discharge, swelling, dimpling of the skin or retraction of the nipple. These persistent changes definitely need to be evaluated by a physician. Now, on your cards on the desk, there's the breast cancer flyer. On the back of that is the 5 stages or the 5 steps in checking your breasts at home by yourself. I had to really dig hard to find these 5 steps. It used to be very common when I was growing up. You used to hang it in your shower and it was everywhere, but it's a little bit more obscure nowadays. But this is how to just screen yourself so that if there is something lurking, you can be aware of it at an early stage. So prevention, there's obviously no way to prevent breast cancer, especially if it's inherited, but there are ways to reduce the risk. Lifestyle modifications, avoiding, those things that put you at high risk, like alcohol or, more breastfeeding, because breastfeeding, they say, reduces the risk. More physical, that's if you're lactating. Physical activity, staying at a healthy weight. They have selective estrogen receptor modulators. And sometimes people at high risk, they get prophylactic mastectomies to reduce that risk. So that's interesting. So if somebody has a high risk of breast cancer, meaning they're like the risk factors that I mentioned, but they can actually have a take off both breasts. And I have a close friend that I went to medical school with. She's my age. She just did that. She was at very high risk of breast cancer, so she took off both her breasts just to avoid that diagnosis because so many people in her family had it. Treatment. Treatment is much more successful when diagnosed early, obviously. The treatment depends on the type and the stage at which you catch the breast cancer, the characteristics of the tumor, the patient's age, whether they're in menopause or not, and also the patient's preferences. So treatment may involve breast conservation, as in not taking the whole breast, via a lumpectomy, taking out the lump, with or without taking axillary nodes. And some can be treated with hormonal therapy after surgery, while others require surgery and radiation therapy, chemotherapy, and immunotherapy. Now, when I was going through the data, it was interesting to find out that the statistics are slightly different for Black women. So breast cancer in Black women. Black women have slighter lower incidence by 3%, meaning new cases. So incident means the amount of new cases. So Black women have slightly lower new cases than white women, but Black women are 42% more likely to die from breast cancer than white women. And this really reflects racial disparities in healthcare. And I'm a physician and a Black woman, and I definitely do know and see that healthcare disparities exist. So breast cancer is most commonly diagnosed. It's the most common diagnosed cancer in Black women. Early stage breast cancer is typically localized within one breast and has a 99% 5-year survival rate. As we said before, that's similar. The overall 5-year survival rate for Black women is 80% versus 91% in white women. 52% of breast cancer in Black women is diagnosed at the local stage compared to 63%. So that's to say that Black women are at a disadvantage when it comes to breast cancer. Black women under the age of 40 have higher rates of breast cancer when compared to white women. Black women under the age of 35 get breast cancer 2 times at the rate of white women and die from breast cancer 3 times at the rate of white women. So what's the problem? Why are Black women dying unnecessarily? Higher death rates among Black women reflect a multitude of things. Black women are not taking action. While 92% of Black women agree that breast health is important, only 25% have taken steps to understand the risk factors for breast cancer. Black women are often diagnosed at more advanced stages. They may not have access to health care because of, therefore, lack of screening. Black women do not get the same prompt and high quality care as white women receive. And Black women have the highest odds of getting triple negative cancer, which is the most aggressive cancer. So we definitely need to work with the community to understand the risk factors and to fight this in our community. One of the organization that we're donating to this year is the Sisters Network, which is the only Black African American, and it's always hard. They say African American, Caribbean American, Caribbean. You don't know what to call people, but that's why I'll just generalize and say Black women. So the Sisters Network is the only Black women's health organization for breast cancer, and they go at battling these type of disparities. So women do not need to die from breast cancer. Breast cancer survivors most often expressed uncertainty about treatment options and concerns about changes in their appearance, hair loss, lymphedema, hot flashes, infertility, and guilt in delaying screening and feeling that they brought their own cancer on. They have fears of recurrence, chronic and acute pain, fatigue, depression, sleep difficulties. A cancer diagnosis can profoundly impact the quality of life, and clinicians should assess for physical, social, psychological, and financial issues. Throughout a patient's cancer journey, it's very important that clinicians and patients share information and coordinate care as a team. Thank you, and that's it for my presentation. Thank you. I'd like to also introduce our keynote speaker. We have today Reverend Dr. Pam Powell, Orlando's Oprah, the Hope Doctor. She is a 3-time breast cancer survivor and recently survived a battle in 2022. She is a woman of many talents, ordained minister of the gospel, doctor of divinity, renowned speaker, radio personality, success coach, and much more. Her speaking audience has reached thousands of people. Today, it is our honor and pleasure to have her here speaking at this event, Dr. Pam Powell.
Thank you. Thank you. Thank you. Thank you so much, beautiful woman of God. Good afternoon, everyone.